I didn't know I had abs until then, Jonathan. You're right, I now can feel them. You can actually use them for the first time. I can push off because I've got power. I've got control. The more six-pack men I see, the more I feel sorry for this society. Because, see, an eccentric and concentric rectus abdominis does nothing for you. Show me your zone. Can you see my bumper sticker? I maintain my zone, do you? Show me the zone. Show me your zone. Show me your rotation. Jonathan, you rotated pretty well on that table. 13-13. Remember that? I didn't do anything for his back. I didn't even touch your back. I didn't do anything to your back. I guided a vertebral column. I guided a vertebral column up on the back as I maximized everything I could get out of that zone in the front. Is that helpful? Just to review, what did we do yesterday and why would we even do it? Did we just do the manual technique because it kind of feels good? No, we did the manual technique yesterday to shut off tone. Oh, and I said it. If we shut off tone, Tyler, I decrease your need to fight torque. I decrease your need to fight tension. And I'm going to hit that a lot in this course because that's why you do it. It's more than just a musculoskeletal issue. It's behavior. It's neuro. It's respiratory. It's sympathetics, which is autonomics, which we went over yesterday. Page 19. Take a look at that, baby. Yes, Rick.
The top of the summit of the right diaphragm at the zone is different than the left, but still close to that range.
Jen, do we have that picture of the cupola in here written by, where the cupola is? I don't know if it's in this course. Is it in this course? We got the, to answer Rick's question. Yeah, I think it is. Let's see if we find it here. You know the football that's inside the cavity, Jen? Picture. You probably have no idea what I'm talking about. In one of the courses, I have so many, I get so confused, Rick, which course I'm at, but in one of our courses, we have a diagram that has a picture of the right cupola, the right summit, that I'll pull up at break and show it to you, okay? And basically, and I'll pass it around, basically, it shows the right side's stocking cap inside. That's very, very pronounced versus the one on the left side that's not. And the reason it isn't is because you've got a heart over here.
Well, my question was more related to the T4 and T8.
Correct.
And those relationships are still fairly close to both sides.
They are. That relation's close to both sides, but here's what happens. So if our right cupola drops, now you're skewed, you have a cant, a C-A-N-T, you're in a cant position. And we as humans want to cant our T4 and T8 lines to help breathe on the left side in the posterior mediastinum. So Rick, they should be at the same level on both sides, but we are symmetrically canting them or putting them in a position where that neurologically you don't want them to be in. Therefore, I came and told you that I want to see that right side, right T4 line and T8 line, stay there by maximizing airflow above that line so that the airflow below that line on the other side can exist to reduce that drive for that cant. And if you see the picture of T4 and T8 in this illustration that I'm going to find for you, you'll see that on the right side, you have to really work harder at getting air on this right behind the collarbone and the first and second rib than you do on the left side. This whole thing I'm talking about today is called the superior T4 syndrome, and we're going to go over that. And you're absolutely correct in saying, I wonder if they're both the same at the same level on both sides. Our goal is to get them both at the same levels on both sides. And then our goal is to make sure that we don't walk away from the patient without maximizing that airflow more on which side, Rick? The right side. Because if you walk away from that patient and you did not maximize that area on the right side, that superior mediastinum on the right side, that patient's going to be back in that position you were when you started. So we have two concepts today. Superior apical expansion on which side, Rick? Left posterior mediastinal expansion. Those two things we're going to be concentrating on in this class. And I'm just laying the groundwork. And when it's all said and done, you're stopping and you're standing, those two lines should be what? Straight across. Rest. And that's where your symmetry would come in if you were to look at how the level of those lines would look, levels-wise. Good question. This is the left lateral mediastinum. And on the left lateral mediastinum, you have this heart here. See the heart? I call it the, every room's got a air conditioner, every basement in a house has a room where there's an air conditioner, maybe a water softener, maybe a purifier of some sort. I call it the utility room. Do you follow me? This is your utility room. You got a boiler, heating up some water for the house. This is that room. It's a functional room. You don't have a lot of storage space in this room. You can put a few suitcases in this room, but you're not going to get much more in this room. And Rick, we got to maximize this. We got to maximize this area right here in this room, this posterior mediastinum in this room. So we'll spend some time on that today. And if you don't maximize it, it crumbles. It compresses. That's what this illustration is depicting. It folds over on itself. You saw yesterday some flares. You remember those flares? And the left side pops up. The ribs kind of get close. They're not opening anymore, Tyler. They're stuck in extension. It's very sad to see. And I mean sad. So I'm asking you, what's going on in your body? And what's going on in the bodies of the patients you're working with, and the clients you work with? Because that's sadness when you see flares. That means their power. When I see huge flares, I know they don't have power. They're just trying to get through the day. They're tired. They're exhausted. They can't shift. See, my attitude, my behavior reflects what I know about movement, disorders. You can do everything you want on some of these people, but they get to a point, Linda, where their ribs have changed, that they're malformed. And now I have to work within the constraints of the malformation. So yesterday, I'm going to remind you, what are you going to do with that little boy, that neighbor boy, that little girl? I hope everything in the world to prevent that rib from becoming what? Malformed. That chest wall looking like that. Because it's too late once it starts to look like that to maximize, Rick, cupula expansion on the right and mediastinal expansion posteriorly on the left. It's hard to maximize at that point because you now have dysfunction that you cannot overcome. Because the attitude that I am giving you didn't exist. So the main focus of PRI brachial chain techniques are the following. Number one, I think this is in your handout on page 37. Number one, we got to increase the right chest wall flexibility for right lung expansion. Number two, we should improve the left diaphragm's position and role as a muscle of respiration. It's all about position. This entire institute is number two. Are you in the right position? And when I say are you, and now Stephanie, I'm not talking about are you. Is your diaphragm in the right position? Are you, meaning that's your diaphragm. Because when I say the word you, I'm thinking breath. That's what keeps you alive. Otherwise, you wouldn't be you. You'd be gone. You would be gone. Is your diaphragm in the right position? We have courses that teach how to get into position. 2 other courses for sure do that. They're teaching how to get diaphragms in what? The correct what? Position. Because you do have 2. There's a plural there. Diaphragms. There's a pelvic diaphragm that is reflected by this diaphragm. But number 2 is big. Number 2 is today, yesterday we put you in the right position. Jonathan, we got you in the right position. I know walking away from you, I didn't do anything for you. I just put you in the right position. By the way, I did it either manually or what? Non-manually. If I can't get you non-manually, I'm going to have to do a what? Somewhat of a guidance to get that diaphragm there. I'm going to get it done. I like that commercial, Nike. Get it done. I'm going to get it done. I'm going to give you a zone. It may be a little teeny baby zone, Sonia, but I'm going to get it done. I know you're 6, 7 inches away from the floor, but I'm going to get this done. I'm going to get you as close as I possibly can. Number 3, decrease the demands on the right diaphragm for respiration. What does that mean? If I want to decrease the demands on the right side for respiration, where do the demands do I want to go up for respiration? On which side? Because as humans, you don't have a good ZOA on the left side like you do on the right side. I want to give you a program that's always going to make sure that I increase the demands for respiration on the left side. See, your left diaphragm is kind of posturally holding you into place. And then I want to do everything I can to structurally get you to do less compensation, which means I want to put in some muscles here that are going to complement both diaphragms. When someone asks me, what does the Institute have these family of muscles for? Susan, it's very, very simple. The muscles, the family, that 4-day course that goes over all those muscles of that family, really have one king, one queen. Who's going to be leading that family of muscle? The diaphragm. What do you want working with your right diaphragm, Kurt? What do you want working with your left diaphragm? What frontal plane muscles do you want with the right diaphragm? What frontal plane muscles do you want with the left diaphragm? What sagittal muscles do you want to work with your left diaphragm? Do you see what I'm doing now? Because everything focuses around you. Stephanie, you are the diaphragm. What muscles do you want in a transverse plane with the right diaphragm? What would you want in the diaphragm's left side for muscles in the same family? We can't cover all that today, but that's what I'm thinking. Because if I can't put muscles that are going to be working with that left diaphragm, how are you going to manage that left diaphragm when you're shooting a basketball? How are you going to do it when you hit a golf ball? See, my world focuses around you. You're not symmetrical. You have 2 diaphragms. I'm going to pick up a book that tells me what I can do to get that left diaphragm to become a muscle of respiration. That's what I'm going to do. That help everybody? That's number 3. Number 4, I want to make sure that you get as much flexion out of your body as you can possibly steal. I want to maximize flexion. I'm going to maximize it as much as I possibly can to allow for better horizontal axial rotation. Chad, did you hear that? Horizontal, upright, axial what? Is what it's all about. It's what it's all about. Otherwise, torque, twists and tears ligaments. And ACLs is a good example of that. And ankles, and et cetera, et cetera. Now, the purpose of the posterior mediastinum we outlined, this is new in this course. And I think because of this predisposed information you got, I'm predisposing you to things you're going to need to know in terms of correcting some of this, helping people correct it. I think it's important for us to sometimes talk a little bit more about this mediastinum. Jen has done a very good job with this. And so I want to make sure that you understand about 3 or 4 concepts. There are about 5, aren't there? 5 concepts that focus around the posterior mediastinum. Posterior mediastinum is number 1, provides positional support for your organs, vessels, and nerves from T4 through to T12. So, right, what's between T4 and T12? T8. What's that T8? The diaphragm. So from T4 to T12, you have a mediastinum. Okay? And in that mediastinum, you have an esophagus, you have a vagal system, vagus nerves, you have a pericardium, you have your thoracic aorta, intercostal arteries, nerves and veins, you've got a lymphatic duct, you have this hemiazygous vein that drains the wall of your thorax, otherwise you kind of blow up. By the way, that's where all the lymph is going through from your legs. chest, your armpit,